And now on WRS, Michael McKay with the McKay Interview.
Hello everyone. Like most of you listening, I've been taken completely by surprise by COVID-19. I had a couple of McKay interviews in the pipeline already recorded, but quickly came to the view that this material would obviously run out very soon. Well, what to do then? What to do in this unprecedented lockdown? It seemed to me that there were only three alternatives. To play you repeats of past interviews that you might have missed, just as many of the big broadcast channels, like for example the BBC do. I have a lot of interviews on a variety of topics, but I feared many of you might have found this rather dull and boring. Another option was simply close the show down until some sort of normality returned and I could leave my home to interview people just as before. Or I thought I could create something new for you, but something pertinent and relevant to the pandemic crisis that we are going through now, because it will probably, who really knows, continue through the spring and into the summer, maybe even beyond. We simply do not know. It also occurred to me that even though you all listen and read widely, and even though you draw your information from a variety of sources, it has been my good fortune over the past 7 or 8 years to bring you a range of expert and knowledgeable points of view by way of my guests. So I thought, why not tap into them and search for a few to provide insights, angles, and opinions on what is really going on here with this worrying pandemic. My aim is not to regurgitate what you already read in your newspapers, news feeds, social media, or listen and watch on your trusted radio and TV stations, but rather to look at the COVID pandemic and its effects through the prism of, for example, history, psychology, the economy, government, politics, security, and resilience, communication, and the media, and religion. And of course, there are many more angles, but all in due course. So to get the ball rolling, I picked first the critically important subject of modeling and simulation of viruses and pandemics. An explanation of this topic would help me better understand all these statistics that are being shared with us by governments, by the World Health Organization, science and research institutes, the news media, as well as armchair experts on social media, and would probably be appreciated by you listening in today. I think the correct word for the general topic is epidemiology. That is the study and analysis of the distribution patterns, who, when, where, and determinants of health and disease conditions in defined populations. It is fundamentally germane to our understanding of what is going on around us now. But, as in life, so too in the modeling and simulation of viruses and pandemics, there's more to it than that. So I asked an old friend of mine, Dr. Bob Bishop, to help me and you listening. Bob has been on my show before. He's the founder and president of the International Center for Earth Simulation Foundation, ICES, and a former chairman and CEO of Silicon Graphics Incorporated, once a Fortune 500 company and now absorbed by Hewlett Packard Enterprise. Bob holds degrees in mathematical physics from the University of Adelaide and from New York University, and is a Doctor of Science from the University of Queensland. In 2006, he was awarded the NASA Distinguished Public Service Medal for his role in building simulation facilities that helped NASA's space shuttle fleet return to flight after the 2003 Columbia disaster. Now, he's going to help me by answering in simple language, some basic, but I believe important questions to aid my understanding. Now, this program is being recorded on the 16th of April, 2020. And the reason why I'm telling you the date is because we're in the middle of a fast-moving public health crisis. Events are unfolding rapidly. Keeping up with what's happening is hard, yet decisions at the national, public health, and political levels are being made on our behalf that affect us almost immediately and will affect our children and grandchildren in the years to come. Because of the insidious and pervasive nature of this COVID-19 disease. And by that I mean that there's no vaccine yet, and the infection rate, the speed with which it can be passed from one to another, is 3 times more than flu. 3 times. Public health policy, government policy, is based largely on statistics, on data, and on modeling. Those who govern on our behalf have to listen carefully to the scientists, mathematicians, and modelers, and then make judgments converted into policy implemented for our benefit individually and as a society. Scientists and modelers seem to be the new gurus these days. Governments rely heavily on their analysis of data in order to formulate policy. We're in the midst of a bewilderingly serious and deadly pandemic. We're in the midst of a whirlwind of numbers and figures. And not to cast aspersions on the veracity or the character of these mathematicians and modelers who feature so prominently, I'm reminded of the words of a dear departed friend, once my boss in Jamaica, a New York Madison Avenue man of the Mad Men generation, the 1960s, who used to say to me when I was a young marketing executive trying to make sense of spreadsheets and research data, remember, Mike, that figures lie and liars figure. Any of you listening who happen to be present-day mathematicians or statisticians, I stress that I'm not casting aspersions on you personally, but that phrase of Dick, my former boss, has stayed with me for more than 40 years. So that's why for this first of these McKay interviews devoted to COVID-19, I turned to Bob Bishop, a trusted friend, well qualified to cast some light on the complications of modeling and simulation of viruses and pandemics and other planetary phenomena to help me avoid the potholes in the road to better understanding as and when I read the data about testing, illnesses, recoveries, and sadly, deaths. Well, hello, Bob. Thanks so much for helping me and being on my show again, even though this time we're forced to observe the social distancing rules and conduct this interview via Zoom.
Bob. Well, good morning, Michael. It's so great to speak to you again, even though it is at a distance.
Bob, my first question is this. Please tell me briefly how this modeling and simulation world of yours got started.
Well, Michael, essentially it all started during World War II, and it came along with, in parallel, high-performance computing. Militarily, it was used for, in the beginning, the protection of transatlantic convoys, and for weapons development, even pilot training, especially after the United States 8th Air Force joined the European battle. Well, soon after World War II, modeling and simulation grew into the automobile industry, then aerospace, civil engineering, climate, environment, and more recently, it succeeded in fields such as medicine, pharmaceutical development, and even entertainment. It's somewhat like a crystal ball. It can deliver forecasts, predictions, projections into the future, but believe me, Michael, it is not perfect. And we'll get into that a little later. However, if it's done well, one can ask these what-if questions, and it's very useful for scenario planning. Michael.
Okay. I just had a question about forecast. Sorry to interrupt you, Bob, but just for clarity, when you as an expert, you know, somebody with PhDs and all those sorts of great qualifications use words like forecasts, predictions, and projections, are they all the same thing, or do they mean something slightly different to an expert like you?
Well, normally the forecast and prediction is relatively a short range. It could be of a few days or a few weeks, whereas a projection tends to be longer term. So it could be out several months or several years.
Yeah, okay, sorry to interrupt, okay.
Well, just to finish this picture of the basis of modeling and simulation, you could argue that it's a third branch of knowledge because it complements whatever we learn from experimentation or whatever we learn from theory. It's not exactly either experimentation or theory. It blends both of those dimensions of knowledge. And today, when you mention modeling and simulation, it really is a blend of 5 activities: modeling, simulation, but there's visualization as well, artificial intelligence, and machine learning. All of them integrate today into this field. And fundamentally, what we have is an advanced tool, which is very useful in the world of big data, because the human mind has significant troubles dealing with very big data. Now, I should just finish this picture by telling you that there are 2 fundamental kinds of modeling and simulation. One is based on physics and chemistry, and follows the rules of the laws of nature. And the other is what we call agent-based modeling, where an agent, in our case now, would be a human. And we roughly describe a human, the characteristics of a human, and perhaps different categories of humanity, and then the way they interact with each other in a village or a city or a nation. And all of that fits under the umbrella of epidemiology, sociology, and even economics. That's agent-based modeling, and we'll talk further about that.
Okay, that's a good opening statement, just to sort of clarify some of those basic terms. My next question is just a little bit more about the pitfalls that we can fall into as lay people reading this information in the press or hearing it on the radio or TV. Just tell me, Bob, why must we be careful about what we read and where we read it? And what are the basic questions that we should ask ourselves when reading reports or watching or listening to scientific analyses on TV or radio? And lastly, what must we look for and understand in the data before drawing conclusions from our models?
Well, this data must be fully vetted. How it is collected, when is it collected, and especially what is the quality and the accuracy of this data. It's all key, because if we have incorrect data, everything that follows will be incorrect as well. These aspects of how we collect data are referred to as metadata, above the data. So in our present outbreak, we can ask if the countries we're looking at are reporting, for example, virus deaths at the hospitals only, or virus deaths in the nursing homes as well, or even virus deaths in the community at large. So what number are we injecting into our models? We need to be clear on these definitions, or when we compare outputs and results country by country, the comparison will be quite meaningless. Another confusion, Michael, can arise if some countries are reporting deaths only when the virus is the primary cause of death, whereas some other countries may be counting deaths even when the chief cause of death is not the virus, but other ailments.
And this is the debate about the death certificate and what's written on the death certificate, isn't it, Bob?
Exactly.
Yeah.
Now, yet there's even a third concern about the data before we move on from data, which is the question of, are we only looking at patients, people who are infected and treated, who have symptoms of the virus? But the bigger question that underlies everything we do now in the analysis is, how about the asymptomatic people in the population that are not being treated and even don't know about the fact that they are carrying the virus? What size is that population? To understand that number, we really need to do random sampling of the entire population, which is a very extensive thing to do. And very few people, very few countries are doing this right now. But it is something we will have to move on to in the near future, because the combination of those that have symptoms of the virus plus those that are infected but don't have symptoms, it's the combination of the two which is most important to know to what extent has the virus already spread within the population.
I see. Bob, there's a phrase, and you know it well, that most people listening will be familiar with too. Don't compare apples with oranges. In this life and death debate that's unfolding before our eyes, this pandemic, and which may even have affected the families of some of our listeners, heaven forbid, please point to me to some of the apples and some of the oranges country to country so that we can recognize arguments and conclusions that may be flawed in this current debate about COVID-19. I mean flawed by insufficient or inaccurate data rather than any desire by the scientists, modelers, or mathematicians willfully to deceive. How dispassionate, Bob, and disinterested are statisticians, or put another way, how dispassionate can they be?
Dispassionate? Yes. Well, provided the integrity of the data is high and provided all the assumptions regarding the modeling are transparent.
And just let me stop you there. When you use a word like transparent in this context, do you mean peer-reviewed data, that kind of thing?
Well, it doesn't have to be to that extent. In fact, in a fast-moving situation, you don't have time for peer review. It's really the spelling out of exactly how the data was collected and its level of accuracy, and in the model, all the assumptions that are built into the way the model works. Unless this is all known, you can arrive at many different varied answers and outcomes. Well, let me go on, because there is this lurking issue, which I've just referred to, which is the structure of the models themselves, something that's quite different and independent from the data being fed in. See, the structure of the models are very mathematical, and models can be built upon different algorithms. They can be constructed for different national needs based on geography, for example, or demographics. And even models can ingest a lot of prior experience from epidemics that have been passed the country in the past, such as SARS epidemic, the MERS epidemic, avian flu, Zika, or Ebola. All these epidemics of the past show us how to model locally and take local conditions into account. In fact, national authorities may deploy multiple models, not just a single model. And what we call an ensemble of models can be used, and then a nation could average over the ensemble and somewhat cover their bases for all the variations they may be trying to deal with.
And that doesn't dilute the information or the result too much?
No, it doesn't. In fact, it gives it, you could say, more applicability, because multiple models mixed together have a higher chance of covering the likely outcome.
I see.
Especially when there's missing knowledge. And because of these differences, by the way, in the way a nation would select its models, each nation ultimately goes about making policy decisions in a different way because their selection of models is different. Now, of course, neighboring countries, you would expect them to share models. And the World Health Organization is grappling with this issue right now and calling for nations to collaborate more in predicting and preventing future hotspots and outbreaks around the world. And that's a good thing. And hopefully, together with a more collaborative approach across national borders, we can defeat this present novel virus together.
So, Bob, just pursuing this theme of modeling and simulation with regard to that, how critically important to good outcomes, to good policy, and to good decisions is time?
Michael, time is perhaps the most critical variable in any model. Well, it's critical for the model to move forward into projecting this future or making short-term forecasts and predictions. And time is critical, of course, if you want the public policy to be set in a timely manner, using the outcome of the models. Well, I should point out there's something lurking here that I would like to expand on, and that is these models deal with what we call exponential growth. Now, this is a very steep growth curve, which appears regularly in nature. And it's so critical to understand this curve to set public policy for travel bans, social distancing, and even total lockdowns. One has to understand the effect of timing and this exponential curve, because this exponential curve has a knee bend in it And once you're on the other side of the knee band, I'm afraid it's off to the races.
So is that what they also call the L-shaped curve or the L-shaped line on the graph, or is that something different, Bob?
No, I think that phrase is most useful for the question of the future projection and the future economy. Do we have a V-shaped recovery, a U-shaped recovery, or an L-shaped recovery?
Okay.
In other words, no recovery.
Sorry to interrupt. Yeah, okay.
Well, if I go on here, in fact, Michael, I want to say that it seems that a shortcoming of the human race is its inability to understand the exponential curve. Now, as a perfect example of how fast it rises, take the number 1 and double it 64 times. It sounds a very simple exercise, but do you know that on the 64th time, you are counting a number which is greater than 18 million trillion?
No, I didn't know. I didn't know, Bob, and that's beyond understanding, I think.
It's hard to believe.
Yeah.
I know. But that's why it's so important to flatten the curve, the famous phrase today, flatten the curve, because this curve is so aggressive, no one can handle it. And you need to deal with it quickly before it climbs, before it goes past the knee band and starts to climb vertical. And timing is really the key issue that you've brought up here. And if you can deal with this knee band and prevent the curve from going around that knee band, then you can slow everything down. You can slow down the spread of the virus and give your medical services the breathing space that they need to handle a possible surge of infections. And in addition, you collect better data and you get more time to develop better testing methods, better therapeutics, and even vaccines. So timing is so critical here, Michael, and that's what people are struggling with. I would actually say that there is a more mundane issue of timing that we should realize as well when we look at the numbers in comparison country to country. And that is the way that the death is being recorded. Is it the report date, for example, that the ICU unit perhaps makes for each death, the report date, or is it the true date of death itself, remembering that there's a high chance that these are not the same dates because the ICU units are so overloaded in the staff. And even many times there's a family identification and notification issues that have to be dealt with. So there are plenty of reasons why when a hospital records the date of death versus the actual date of death are different. And that difference can make a considerable misalignment of the final outputs in any model. And I just bring that up as a third issue of timing.
That's important. Just going to move on, Bob, to another aspect of this whole discussion. That's when politics and policymaking meet science. I had a distinguished friend of mine who used to work for Henry Kissinger in the White House and was a past guest on this show, told me that Kissinger once said, "When I have the greatest room for maneuver and the greatest options, I have the least knowledge to make the decision." I guess no doubt the opposite is true, that when one has the most data, the most knowledge, one's scope for maneuver is often limited. And I guess public health officials in Switzerland and around the world, especially those whose countries are in lockdown, would have sympathy with Kissinger's observation. My question is this, Bob. What happens when science, I mean in this case mathematics, statistics, modeling, mix, as they surely must, with politics and policy making?
Well, what happens, you ask? Certainly a fierce debate follows regarding the choice of models and data sets. And then yet another debate on defining public policy from the model. This is never a tidy process and is filled with hustle and bustle. But in the end, as you already pointed out, there are life and death matters here. And even though uncertainty abounds, hard choices have to be made in a timely manner, and the public has to be informed. So For example, how do you ramp up the availability of PPE, the personal protection equipment? How do we ensure enough ICU beds and ventilators?
ICU is intensive care units, huh?
Yes, right.
Yeah.
And how do you protect all our frontline workers, the medicos, police, security, food supplies and deliveries, public transportation, etc.? Well, these matters and many more require priority treatment in time. At the same time, we have to extend this, what I referred to earlier as random testing across the population, to really understand the dynamics of the virus and successfully understand how to apply the models. Ultimately, the best therapeutics, right now we're struggling with understanding what therapeutics would work, and then when will the vaccines be available. Believe me, Michael, all the epidemiologists, the virologists, the microbiologists, all need to be involved as experts. And you have to arrive at a best consensus decision. And when you arrive at that decision, you can believe that a large part of our society needs to be re-coordinated in some way. The hospitals, schools, colleges, universities, all of these things need to be re-coordinated, as well as the transportation systems. Perhaps the most critical matter that we know now has to be decided is when should social restrictions be lifted. Too soon, and you may cause a rebound, right? Second wave, third or fourth wave. And if you wait too late, then the economy falls apart. So we have to understand our politicians really have a very hard job leading us through this particular conundrum. There's no doubt in my mind today, our society is and will be changed permanently.
Thanks, Bob. And I should add that because this is a recording, it is today, the 16th of April, I believe the Swiss Federal Council will make an announcement about the next stage of its strategy in dealing with this pandemic. Bob, one last question concerning the provenance of data. Given that even in Western democracies, we cannot rely on being told the truth by governments all the time, but at least we can vote out mendacious politicians. How do we know that we can rely on data and science that come from dictatorships where one-party states rule and countries where leaders take upon themselves an almost godlike status? 4 years ago, you told me on this very show that the center of gravity of the world economy and science had already moved to Asia. The world saw for itself, Bob, you know this, how the medical doctor who first brought COVID-19 to the attention of the world and has since sadly died was treated so badly by his own government. Bob, my question is, in science, how do we know what is true?
Oh, Michael, in science, nothing is ever unquestionably true. Everything is open to challenge and debate. That's the strength of science. It's not dogma. Science is evidence-based. Third-party verifiability is the principal criteria in the field of science. Now, the status of this particular virus is that its genome has been sequenced by Chinese scientists, and they published it on January 13th. The race for a vaccine has therefore got off to a rather fast start. However, although China is rightfully criticized for suppressing their early evidence of an outbreak, as you say, which was actually begun in December 2019, Wuhan was actually locked down on January 23rd, which is when the world really took notice. Well, clearly, China, Hong Kong, South Korea, Singapore, Taiwan, Japan, all did a good job in nailing down their population in the current crisis. In fact, these East Asian nations have somewhat traded what I would call an ounce of liberty for a pound of social security. That's why they are quite a ways ahead along the curve in contact tracing.
Just what is that again, contact tracing?
Well, it's a way using cell phone technology and GPS, for example, of knowing when you've had contact with somebody in the streets, in the pub, that may have an infection.
Yeah, I understand.
And trace backwards, therefore, so-called to patient zero.
Yeah.
Well, this is controversial in Western liberal democracies. However, even though I think we in the West will deploy the same method ourselves very shortly, last week Apple and Google announced pairing up to provide that technology. But the key question is this: if we do deploy that kind of contact tracing surveillance technology, what happens when the virus is gone? Do we keep it in place, or do we can it and go back to our liberal ways? I think that is a bigger question for the Western democratic countries, but the Asian countries, East Asian countries, have already made that decision. Well, you've introduced the whole question of political decision makers and the interaction with science, and all I can say is our political decision makers are strung out with so many difficult issues at the same time, at this time. They're only partially supported by good modeling outputs because of the uncertainty in available data. And to make things worse, for the last 2 decades, I believe the global economy has been wound up as tight as a drum. Mm-hmm. You know, global debt levels are 3 times annual global GDP at this moment.
Yeah, I'm aware of that.
And we'll even get higher with the economic rescues that are underway. Well, on top of this, we are still recovering from multiple cascading disasters, both natural and man-made. And we all know in the recent past, like the global financial crisis of 2007 and 8, this is just one of them. My guess, Michael, is we now have few reserves and therefore much less resilience. And as a consequence, I think it's a dangerous time.
Well, Bob, listen, I always try to end these McKay interviews on a positive note, but these are extraordinary times and very different times. And I thank you very much for your patient and candid explanation and answer to my questions. Thank you so much for adding to my knowledge on this complex topic. My guest today has been Dr. Bob Bishop, founder of the International Center for Earth Simulation Foundation. That's the ICES Foundation in Geneva. Thank you, Bob.
Thank you, Michael.
That was the McKay Interview with Michael McKay. And don't forget, you can hear that interview again on our website, worldradio.ch.